All right. How's my mic? Am I live? Here we are. Welcome to week 10. Ladies and gentlemen, BIO201, Anatomy and Physiology here at Arizona Western College. It's your professor, Dr. Shawn Clavell. And we have come past the halfway mark. We're here in week 10 of the semester and we're preparing for, let me fix up that announcement there for the exam that opens midnight tonight. Bones of the body. So as you can see, the exam will open on March 21st at midnight Thursday. It will close on the let's say the 25th Monday. It will be the two parts as we've talked about. Part one will be more of the traditional multiple choice, multiple answer type questions, chapters 6, 7, and 8. The skeletal system. So I've lengthened it a little bit in terms of the number of questions, kind of adding a little bit more as we progressed here. So they're up to 75 multiple choice questions, 1 point each. You will have 2 hours to complete them. These are some of those traditional multiple choice, multiple answer questions that you've been seeing. So I should also note here that a good portion of these questions, probably 2/3 of these questions, come from chapter 6 regarding the bone physiology, endochondral ossification, versus intramembranous ossification. So, again, if you take a look at some of the chapter 6 versus chapter 7 and 8, where 7 and 8 we really talk about uh, the bones specifically and their specific landmarks. So that's going to be a big one too. So let's just take a look here. Let me give you a couple of uh, review or practice questions that you might see here on the upcoming exam. So, in regards to these multiple choice questions, these multiple answer questions, you're going to be some questions that relate to, again, chapter 6 is going to be a big one. There's going to be probably about 45 to 50 questions related from chapter 6. And so I'm just pulling up my question bank here so that I can take a look at some of those questions. Bone tissue and the skeletal system. So, looking here about the functions of the skeletal system is going to be a big one, right? So, what are the functions of the skeletal system? What is the structure of a long bone? What is the structure of a flat bone? What are the differences of the skeleton as it relates to their location? Let's break it down here. I'll pull up these uh, components that we're talking about here on some slides if we need to. But the idea of chapter 6 is really kind of like the bone physiology, the structures of bone, and then specifically chapter 7 is the axial skeleton, so all of the bones of the skull and the vertebral column. So again, think about the functions of the skeletal system. One that's often less forgotten is the production of red blood cells, right? So the production of red blood cells, it's referred to as hematopoiesis. So we commonly identify that, bones support the body, they facilitate movement, they act as levers in terms of biomechanics, right? Your joint, the area of movement is the fulcrum, the joint is the fulcrum or the axis point, right? Your muscles actually provide a force in which your bones act as a lever. We classify bones, right? We can classify bones in a couple of different ways. So the first way that we classify bones is based on their location, axial skeleton versus the appendicular skeleton. And this is what our textbook looks at in chapters 7 and 8. We look at each of these bones specifically, and they break it up in terms of the axial skeleton and appendicular skeleton. We also classify bones based on their shape, right? And so in terms of the complementarity of form and function, right? The shape of these bones also allows for them to have different functions. So you got long bones here. Long bones are often related to movement. Flat bones are related to protection. So you're going to find most of your long bones in your arms, in your legs. You're going to find areas of like meet where your hands meet your arm is these short bones. So you've got short bones like your carpal bones. You also have short bones in your ankle, right? Your tarsal bones are referred to as short bones. So again, we've talked about the classification of bones, whether it's location wise or in terms of their structure or function. The bone structure themselves, primarily the most complex one is that of the structure of a long bone. So again, you might want to review the structures of a long bone. Where does the endosteum and periosteum lie? What is the chemical composition of bone, right? What is the chemical composition of bone? There's inorganic components that lead to certain characteristics of the bone. There is inorganic components that lead to other characteristics. I'll give you the hint here, right? The collagen fibers are the organic, they're protein fibers. They provide for the flexibility of bone, whereas the inorganic components, also referred to as hydroxyapatite, are the calcium salts that provide the bone its hardness and brittleness. What are the cells, right? What are the different cells related to the bone tissue, right? What bones do we see? We see an osteogenic cell, an osteoblast, an osteocyte, and then a different one of a different class from a class of white blood cells is an osteoclast, right? We looked at the microscopic anatomy of bone that looks at that's this chart here. So be familiar with the kind of like the structure of bone. And maybe more specifically in the practical, you're going to see pictures related to bone tissue histology, right? So be familiar with the different structures associated with the bone tissue. And then the other component here is the bone development and formation. So the two concepts here are uh, endochondral ossification versus intramembranous ossification. So endochondral ossification follows a few steps, and we should be familiar with those, whereas intramembranous ossification follows a very similar format. However, endochondral ossification starts with a hyaline cartilage model, which again those long bones develop from, and so just thinking about that, you should be able to identify cartilage on a model as well. So being able to identify cartilage on a histology slide will be also important. And then intramembranous ossification. Your bones, after that, your bones grow two ways, right? Your bones grow in the epiphyseal plate. So you can grow at the epiphyseal plate. There it is, right in the screen there. Uh, and that's as your bones grow through your adolescence, but your bones continue to grow wider, right? Your bones grow wider throughout your lifetime, and that's called appositional growth. So be familiar with the technique of appositional growth. And then finally, in this section, remember the fracture repair, right? Like, what are the stages of a fracture repair? What are the first steps? What are the second steps? And what is the third step? And so that's what we're looking at when we talk about the uh, multiple choice, multiple answer type questions here, getting familiar with the uh, chapter 6 specifically. And then in chapters 7 and 8, what we did is we looked at the different bones of the body. And so let me see what I have in terms of some practice questions there. That's what I was going to pull up on my canvas. And so what you'll see here, let me see if I open up if I got a writing tool here. We're gonna go. I'm pulling these right from the practical. So let me take a look here. I've got over 70, 80, 90 questions you can pull from here. So just to go over a few lab practical bones, and so here's what you'll be seeing. So just to again a few here. Uh, Throw that up on the screen for you, right? Identifying that parts of the osteon, right? Like what are the parts of the histological structure of bone? So being familiar with those structures is going to be important. Well, I shouldn't say what it is, but there's one, right? That's a structure histologically we should be identifying with. But then here you go. Here's a structure, right? So I'll give you this one here. It's identifying the indicated, identify the indicated located on the osteological features. What I'm going to say, I'll fix this question here, but identify the indicated feature located on the posterior proximal feature femur. So this is actually called the lesser trochanter. So what I would write in the for an answer here would actually be lesser. Let me try that again because I missed. Right. Oh, that's an H. Should be an H there, but lesser trochanter is the term there that you would use, and so that is what you would put for the answer, right? Some of these questions, maybe make it. Let's make it pink. That'll show up there. There we go. And that's what the indicated located on the posterior from that is the lesser trochanter. You've got a greater trochanter too, right? Like there's one, right there. That's the greater trochanter. That's the lesser trochanter. Your hip flexor muscles attached to that one, iliopsoas, and yeah, iliacus and the psoas muscle combined are make up a muscle called iliopsoas. But that's what you would write, right? Like you'd put in what is the identifying feature. Again, if we want to stay, some of these might answer what is the name of that bone. So you'll get a question there, like what is that bone? I won't give you the answer to that one. There's one that you should know, right? Like the calcaneus, right? So you just type in the answer calcaneus. Now I'm going to find one here that kind of just asks, here we go. So this one here is saying, it's asking, identify the feature as well as the bone that it's attached to. So for full credit on a question like this, what you would write is, this is the medial condyle, femur, right? Comma femur, or you could say it is the medial condyle of the, or you could say it's the medial condyle of the femur, right? Like that is all you need to write for a correct answer here. It's 3 words, and I typed in femur incorrectly. This I'd probably give you credit for, right? If you typed in femur accidentally with a little misspelling there, but if it's there more than one letter or transposed, you'll lose a quarter of a point out of 1.5 on this. So you're looking at that structure, these structures here. And so let's just give you one more here for practice. Clear this off. Let's say, again, this one is on the humerus. So it's really on, oh, here it is right here. This one gives us one that identify this indicated osteological feature. You can see it right there on the screen. Maybe zoom in a little bit. as well as the bone it is attached to. So for full credit here, the correct answer would be this is the, and it kind of comes in the name, right? It's the spine of the scapula. So that is the name of the feature. That's all you put in for full credit, right? Spine of the scapula, spine of the scapula. And so you'll have 50 questions, so picking different bones. Again, these are more the appendicular section here, but I do have features of the vertebrae, right? Vertebrae, the axial skeleton, that's chapter 7, the skull, the different parts of the skull, and you can see that there. So practical, right? It's going to be questions related to the different parts of bone, as well as the histology of bone. So as we've mentioned here, that part two is going to be, let me see if I can't fix that too while we're here. Again, chapters 6, 7, and 8. That is the skeletal system, which includes some histology of bones, cartilage, and any other associated structures, right? 50 questions, 1.5 points each, 90 minutes to complete. I think this is going to be a good exam. I mean, this sounds like a lot of fun for me. But I shall leave the fun and pleasure and enjoyment to you guys. Again, I look forward to all your responses, finishing up grading those lab assignments here. Hey, stay strong. Week 10. We finished week 10, ladies and gentlemen, or we're finishing week 10, well past the halfway point. 6 weeks to go. A little bit of spring break coming in there. Throw a little spring break in the mix, and we are finishing strong. Going to go through the muscles of the body. Who doesn't like muscles? Got to work on some of those movements as well. And then the nervous system. Nothing gets more complex than the nervous system. So let's have some fun. All right, let's wrap this up. Thank you guys again. Take care. And I look forward to all your responses as always.